I guess probably everyone knows now we have a new president, and the 119th Congress has begun. So, we start by saying we were Americans for Safe Access. We are a patient advocacy organization, but we bring together stakeholders from within healthcare and the cannabis community to advance a national regulatory framework that invests in standardized cannabis products that will ensure a safe and consistent supply and foster the integration of cannabis into patient treatment plans as a frontline medication. And within this model, we want to ensure insurance coverage and prohibit employment, housing, parental, or healthcare discrimination. So that's the frame that we're always looking at policy through. So remember this, the president made, I guess, a lot of promises on the campaign trail, as people do. There was a lot of headlines around Trump being supportive of Schedule 3. He made several comments about supporting medical cannabis, and he even said he voted for the initiative in Florida, although I'm pretty sure he just did that to make DeSantis mad. But the truth is, from the position of president, actually doesn't have the power to do either of these things. Actually, the Controlled Substance Act, the way it's written, actually the president has no direct role in classifying drugs. So the only thing that a president can do as far as the schedules was what Biden did, which was actually ask HHS and Department of Justice to review the current scheduling of these substances. And because there is currently a process in place, the president wouldn't be able to repeat that process until the current review is over. And so many of you know that's been delayed, and I'll talk a little bit about that in a minute. So the answer as far as which of his promises can he keep, well, he can either change the schedule or legalize it, I think is what he said once. So we have to look at, what the president, obviously the president has a big agenda. He's done a lot of things in the last 24 hours. But there are actually things that are in his purview that he can do that could greatly improve the lives of patients. And then, of course, we have a big agenda for the next Congress. And so in the spirit of political campaigns, which I'm sure if you heard any news about a new administration, everybody talks about the first 100 days. And it's really because of the first 100 days of a presidency, especially, it sets the tone for the next 4 years. And it's really, it's before there's too much power going against other initiatives. It's before sort of a reality check of what can get done. But in the case of medical cannabis, there's a lot going on. And so we really want to utilize these first 100 days so that we are setting the tone for what we need from this president and from this Congress. And so we're going to see a lot of messaging, and tomorrow we're going to have a website up with all of these resources for you, but I wanted to give you guys a preview to know sort of what's possible and what we're going to be working on. So there are 5 actions that the president can take that would really impact the lives of patients in the United States. And he can do these without involving Congress. And so I'm going to talk about those right now. So the first is addressing this issue of evictions in federal housing. So there was actually a couple laws that were passed that basically created a requirement for actually the landlords that they would basically create drug-free zones within their rental properties. There have been, a couple memos from HUD that says that, the landlords, it's up to them. They don't have to evict someone. But for a lot of a lot of patients, even, the fear of being evicted means that they're choosing between using medical cannabis and risking their home. And so this is actually something that the president can do by executive order without involving Congress. Um, you can also create a policy at the Veterans Health Administration, allowing healthcare providers to actually not just recommend cannabis, but actually fill out the paperwork. So there's a directive 1315 that specifically says that healthcare providers are prohibited from recommending making referrals or completing forms or registering veterans to participate in state-approved cannabis programs. So, over the years, we've been sort of chipping away at some of these policies. So there's not, right now, the VA says that you can't lose your benefits just for using medical cannabis. But right now, for people who are solely dependent on VHA for their health care, and can't afford an out-of-pocket cost of seeing another doctor, they're really caught in a hard place. So this is something that through executive order, the president can do, or he can, just direct it doesn't have to be through executive order. He can also just direct the new VA director to create a new policy. The other thing that he could do that I think would really impact a lot of patients across the United States, millions of patients actually, is actually remove this requirement, this anti-drug requirement of federal employees that was actually created under the Reagan administration. It requires drug testing, random drug testing, and again, just this would be an executive order, and he could just get rid of this policy altogether. I think because of HIPAA laws and the requirement, the rights under they've been fought for under the American Disabilities Act. Patients shouldn't have to out themselves for being a patient, and so the easiest way to deal with it is just actually just get rid of drug testing for cannabis, which is what we've done in DC and a few of the other states that have just medical laws. The other thing is actually reinstate the Cole memo. Some of you may not remember the Cole memo, but under the Obama administration, there was a series of memos that went back and forth, and the two of them were called the Cole memo, but basically it created instructions for U.S. attorneys on basically a set of guidelines that that medical cannabis and adult use cannabis programs could follow. And if they followed these guidelines, then U.S. attorneys were discouraged from enforcing federal cannabis laws. The beginning of the last Trump administration, Sessions, his attorney general, then actually got rid of the Cole memo, and nothing has replaced it. So actually right now, all of the adult use cannabis programs are completely illegal. There's nothing protecting them except for the will of the president and any directive he has to the Department of Justice. And medical cannabis programs are protected under an amendment to the justice budget that we have to reauthorize every year. And so this is something he can actually direct the Department of Justice to reinstate. And I think in a minute, I think we'll see why we'll all feel a lot more comfortable if he does that. And then, something that's pretty common for a president to do is actually call on Congress to put legislation on his desk. Um, I almost said his or her. One day we'll be able to say her. But this is actually sets a tone for Congress. So any um, you know worry within either his party or the other party that this is just not something that the president would entertain. It kind of shows that there's a willingness, and it'll also give incentives for members of Congress that may be waiting or putting cannabis legislation on the back burner. So within each of these campaigns, we're going to have a series of actions that will include some social media components. You'll notice we have hashtags for each of these, but we're also, as various heads of these departments, get confirmed, we'll be using those as opportunities to bring this issue up to the press, and to get on the radar of not only the president but also his chief of staff, his press secretary, his policy director, and of course the director of that agency. And so, if you're not signed up to get alerts from Americans for Safe Access, you can go onto our website and just sign up, and so you'll get email alerts, or you can also, um, you know, like or follow our social media channels where we'll also be posting these. So again, for each one of these actions, you're going to see sort of a different hashtag, different targets. But I think, there's a lot of educating for people to do to understand even that these patients are suffering and that the president can fix this. So the same thing with the Office of Personnel Management. That's the sort of HR for the entire federal government. This is something that the chief of staff, with an executive order from the president can enact, because there is an existing executive order around drug testing. The president would have to sign one, and I hear he likes executive orders, so could just slip it in there as he's signing away. The same thing for the Cole memo. There's the standing language. It's there. It wouldn't be that hard to reinstate. Most of the U.S. attorneys remember being under various Cole memos. And again, I think this is really where we need to do some educating, both of the public, but also people within the cannabis community that may not remember what it was like during the time of raids. And there's a lot of question marks right now. So as many places as we can have protections for these access programs, the better. And we are working within both the House and Senate right now on getting our legislation ready to introduce, and it is our goal to have our legislation introduced in the first 100 days. But obviously, having Trump call for Congress to put something on his desk, it will increase the number of champions and people who sign on. And so, on the website, there's gonna be all sorts of campaign materials that you can download. One pagers. There'll also be social media shares, and this presentation will be on YouTube if you wanted to share it with people, and also this presentation. And then we also have presentation slides. So if you're giving a presentation to another organization about medical cannabis, you can sort of add this campaign into the current work that you're doing. So even though the big news has been around Trump this, at least the last 48 hours, there's also a new Congress. And so This new Congress includes 9 new senators, there's 4 Democrats, 5 Republicans, and 63 new members of Congress. So 33 Democrats and 30 Republicans. And whenever there's and they refer to them as the freshman class, it's really a lot of these individuals are new to Congress, and we really have the opportunity to sort of tell the story of cannabis through a patient perspective and to get to them first. So if within your district, you have a new member of Congress or a new senator in your state, you want to be the first person, that talks to them about medical cannabis. And so we'll be sending out some action alerts so that you can introduce yourself, but you don't have to wait for us. You can, go to their webpage and contact them directly and just introduce yourself as a patient advocate and let them know that you're there as a constituent to answer any of their questions about medical cannabis. And there's going to be a lot coming their way. And so, we also, I did a presentation this last weekend. If people would like a copy of it, helping people explain, how to talk about our federal legislation. And then we also have a lot of other tools. But, as, for this new Congress, we want them to see, what just happened within rescheduling from this perspective, right? No matter what happens within the scheduling process, what is important about this whole process is that cannabis has currently accepted medical value according to our 2 top health agencies. And so, we all know that none of the schedules actually really work for cannabis. But we also know that from the last Congress, a lot of our allies felt like there wasn't anything left for them to do for medical cannabis because of misinformation that either Schedule 3 was going to take care of medical cannabis patients, or this idea that the adult use and hemp market are meeting patients' needs. And so, we want them to see information about, how patients are using cannabis, that they're actually substituting medications for very serious disorders, that they're actually using cannabis instead of opioids, that they're replacing sleep aids and muscle relaxants. And that way, when they hear information about people using cannabis on a daily basis, they'll see it through the lens of a patient and not through this sort of prohibition mindset that is being put out by addiction journals. This idea that cannabis use disorder, which, by the way, every patient has according to the requirements of diagnosis, because you have to have 2 of 11 symptoms, and 2 of the symptoms are you use cannabis every day and you would experience discomfort if you stopped using it. And so, at the end of last year, we started seeing a lot of sort of backlash around public health concerns. And I think as medical cannabis patients, we need to lean into this and be there for our members of Congress and senators as they're hearing this information, to be there to give them the other perspective and really understand what's happening with cannabis policy. When our members see that, every state in the United States has passed some type of medical cannabis law except for Idaho, and every territory except for the American Samoas. We want them to see that as momentum, as compelling them to need to act for medical cannabis. But what we don't want them to see is sort of the framing we saw in the last election, that adult use is the goal of medical cannabis. And so they're only going to know the difference if a patient advocate is there to tell them. We want them to see the sort of the rescheduling process that may or may not move forward at this point. We want them to understand that as policymakers, the impact of the findings of FDA and HHS means that patients no longer have to prove that cannabis has medical value. And what we really need from Congress is to work with us to figure out how to get it to more patients. And we want them to see that instead of looking at, these issues about taxation and some of these other items that may or may not come to pass. We want them to understand that there is bipartisan support for medical cannabis. That, in the 117th Congress, not the last Congress, but the one before, we did pass the Research Act through a bipartisan um, uh, effort, and that, this is not a Republican or Democrat issue, but this is a patient issue. And again, if you're not there to sort of give them that history, they may not know. You know, they may think that our idea for how to move forward with medical cannabis is pie in the sky or complicated, when in fact, as Congress has been debating some of these issues, the Congressional Research Service actually, told Congress that creating an alternative regulatory framework for cannabis might be, a good way to move forward. The idea of creating a new schedule isn't something that we just pulled out of the sky. In fact, again, when they were looking at the implications for rescheduling, one of the suggestions that the Congressional Research Service made is actually, creating another schedule for cannabis. So everything that we're doing is grounded in 23 years of experience in creating safe access for patients. But unfortunately, we're not coming into this Congress with just sort of a blank slate where, if we don't feel like getting up and talking about medical cannabis, nothing's going to happen. And so I'm going to explain that real quick. So one, the rescheduling hearings have been postponed. And our experience with Congress has been, and I'm sure I heard the other day that some of our advocates in the states are even having this experience, that, if there's some way to punt dealing with cannabis, elected officials will find it. And so the idea that there's this pending rescheduling process it can be an easy way for an elected official to put on their wait and see hat. And so we're really going to have to be there to explain that actually this rescheduling process isn't going to help patients in any way, whether it's 2 or 3. But Congress can act anytime to create a schedule that would work for patients. And if folks want to know more about what's going on with the rescheduling hearing, you could check out our blog. We're covering it pretty regularly. So the other thing, I don't know if folks saw who Trump has tapped for the position of DEA enforcement, the new director. This guy's pretty anti-cannabis. Good news is it looks like only 11 people agree with him. I think they're all probably fake accounts from someone we know. But this is pretty serious. In the middle of this sort of limbo with this hearing, having someone that is very anti-cannabis, is going to be a problem. He at one point, blamed a school shooting or a mass shooting on cannabis use. So, this doesn't really look like a scientific conversation is going to continue at the DEA. And, we also have this issue of sort of, there are policies that are moving forward. There were some bills introduced around adult use and decrim, but also Congress is trying to deal with the cannabinoids from hemp. And so within that, there's this suggestion that cannabis should go under the FDA and be regulated like tobacco. And this could happen actually through hemp legislation. And we sort of see this in these various bills that have come up. And so again, if we're not there to explain these issues to new members or to our even people that were in the last session, they may not have heard this. Cannabis being in the FDA, it sounds like a good idea. It sounds like potentially moving into medicine. But, if we look at, the language this is modeled after, the Tobacco Control Act, it would actually create huge barriers for products to move forward for patients or for any of those markets. And so the last thing we want is to finally, pull away some of the harm of the Controlled Substance Act to find cannabis, being sort of locked into FDA, because FDA has been very clear about what they think uh, that the future of medical cannabis should be, that it actually has to go through the drug approval process. And we know that's been a non-starter. And it wasn't just the Controlled Substance Act that sent us to the states. It was also this lack of a pathway for medical cannabis at the FDA. Some of the other things that we have to keep our eye on is that last session, House Republicans passed an amendment in the Department of Justice budget, actually two amendments, one that would stop the rescheduling efforts, and another one that would actually sort of claw back the protections of our medical cannabis amendment. And so, I have no reason to think they're not going to try to move this forward again. And this means, I'm sure you've seen drug-free zones in your communities. Uh, well, drug penalties are double within those spaces. And so while some of our state programs have created some of these perimeters, they're not as restrictive as what the federal definition of them is. So if this passes, that could be very dangerous. We know, even though the president says he's never read Project 2025, definitely his advisors have. They've written it. And there's a lot of language in here about returning to the rule of law, that if, states or cities have passed laws that that they deem putting people in harm, that the federal government should be able to enforce federal laws. And they're even talked about, going back to prosecuting drug possession, which the federal government has not done in a long time. But also within the election, with the Republicans winning back the Senate, some of the last remaining really anti-cannabis elected officials are now in charge. So, last year there was a letter sent from House and Senate Republicans to the Attorney General admonishing him for the idea of Schedule 3 classification for cannabis. And now all of those signatories are now in key positions of power. And so this means that, any sort of agenda that the House pushes through, they're going to have counterpoints in the Senate that could, move that into law. And so we have a lot of resources to help you with educating members of Congress. Again, this will be up on the website in the next couple of days. And if you are on our email list, you'll get an alert as these materials come up. They include not just guides to help your lobbying, but also one-pagers and talking points and guides to talking to the media. But I really want folks to understand that there really is, everything is really up in the air. And that means that there isn't time to sit by and wait for these things to fall. We can impact what the future of medical cannabis is, but this is happening with or without us, and without patient advocates. I'm not sure where these pieces are going to fall anymore. And we have a lot, we've really changed the hearts and minds of the of healthcare providers. We know that this country is in crisis, a healthcare crisis, and we know that medical cannabis can be a part of that. So a lot of the messaging we're going to be putting out from ASA is really connecting medical cannabis to major healthcare issues. And I'm just going to jump to the end here. Again, I will make this whole presentation available. But if you're with an organization that would like to endorse our federal legislation. This is up on our website, and we would love to have more organizations involved as we start rolling out our Safe Access for All campaign. We also have a sign-on letter, all sorts of tools that we have a petition, things that you can do from home. You can take a screenshot of this and text it out to your friends. So it's a long way of saying there's a lot to do this session, and we're going to need everyone. And so with that, I'm gonna also remind you guys that this will be on our YouTube channel if you need to watch it again or want to share it with other people. While you're there, please subscribe to the channel so that we have a lot of great content that we're constantly updating. And if you want to take another look at the legislation, look at our Safe Access for All. This will take you straight to the language for the legislation. It includes presentations and handouts. And again, look out for the first 100 days campaign, and we'll be 100 days will go by quickly, but we'll have lots of ways for you to get involved. So I went over a little bit. I apologize. Hopefully I didn't make you late returning to work. And I don't see any questions in the Q&A. So with that, I'll say thank you all for sharing your lunch break with me. And I look forward to seeing you guys next week. This is a series that we'll be having every Wednesday at noon.